Trichuris, Trichura. This term in Greek means hair-like tail. However, the literal translation is a misnomer because the fact of the matter is that the anterior end of this worm is the one that is hair-like and not the tail. Therefore, the common name for this large intestinal nematode, the whipworm, is more apt because the thick posterior part resembles the stalk of the whip and the thin anterior part resembles the lash. If you look at the adult worm, usually we find these adult worms in the wall of the cecum and the appendix. The male worm is about 30 to 40 millimeters in length. The female worm, slightly larger, measures about 40 to 50 millimeters in length. The adult worm is flesh colored and is divided into the anterior 3/5 and the posterior 2/5. The anterior 3/5 of the body of the adult worm is thin and thread-like and usually contains the capillary esophagus, which is embedded in the mucosa. The posterior 2/5 contains the intestine and the reproductive organs. The adult worm is flesh colored and it can be easily recognized by observing the posterior end as male and female worms. In the male worm, the posterior end is coiled ventrally, whereas in the female worm, the posterior end is straight, blunt, and rounded. The average lifespan of the adult worm is around 5 to 10 years. Following fertilization, the female lays about 5,000 eggs per day. These eggs have a characteristic brown appearance and thus are called as bile stained eggs. The eggs are triple shelled. The outermost layer is the one which is stained brown in color. It has got a classical barrel shape and measures about 50 micrometers in length and 25 micrometers in the width. The barrel shape is characteristically noted in the middle portion of the egg, and at each end of the egg you have a projecting mucus plug at each pole. The egg of Trichuris trichura or the whipworm usually floats in saturated salt solution. Once it is passed in the feces, this egg contains an unsegmented ovum. At this stage, the egg is not infective for humans. After about 3 to 4 weeks, under warm, moist and shady conditions in the soil, this egg undergoes development in the soil. Slowly, the egg matures into an embryonated egg. At the end of 3 to 4 weeks, however, you can see an infective rhabdiform larva developing within the egg. This mature embryonated egg containing the infective rhabdiform larvae is the infective stage of Trichuris trichura. Infection occurs when these forms are swallowed in food or water. The eggs hatch in the small intestine and these larval forms emerge through the pole of the egg and passes down into the cecum. In about 2 to 3 months, they mature into adult worms and they lay embedded in the cecal wall with the thread-like anterior portion piercing the mucosa and the thick posterior portion projecting out. The eggs usually start appearing in the feces after about 3 months after infection. Please remember that the entire life cycle of Trichuris trichiura passes only in one host, that is from the ingestion of the infective egg form containing the larvae to the development of adults and the release of their eggs in the feces. But for transmission, the egg has to undergo a period of development in the soil to infect another person. So I repeat, humans are the only natural host for Trichuris trichiura. Surprisingly, most of the time, infection with this whipworm is usually asymptomatic. For the symptoms to manifest, the worm load has to be heavy. There are two types of effects that lead to the clinical manifestation. One is the mechanical effect and the other is the allergic reaction to the host. Please understand that these worms lie threaded in the cecal mucosa. Though it is not a blood feeder, oozing of blood does occur at the site of attachment, leading to iron deficiency anemia. The blood loss is about 0.005 ml per worm per day. Over a period of time, malnutrition also occurs due to anemia. Most of the time, the mechanical blockage of the appendiceal lumen by the whipworm masses can cause acute appendicitis. The worm may be abundant during heavy infection in the colonic mucosa even up to the rectum, thereby causing mucus diarrhea, chronic dysentery and abdominal pain. Characteristically, in young children, rectal prolapse may also develop. So this worm is diagnosed by performing the stool microscopy. As the worm burden is usually heavy, one stool sample itself is sufficient to identify the eggs. So the egg of the Trichuris trichiura is the diagnostic stage. The infective stage is the egg containing the infective rhabditiform larva. The classical barrel-shaped eggs with mucus plugs at each end of the pole are seen. Less than 10 eggs per smear in direct stool preparation is considered as light infection, and more than 50 eggs is considered as heavy infection. Please note that the lesser the burden of the eggs, the more chances that the host is asymptomatic. Sometimes we can detect the worms by doing a proctoscopic examination in the rectal mucosa, especially when the patient has got whipworm diarrhea and dysentery. Treatment is usually administered by mebendazole and albendazole. The prophylaxis for Trichuris trichiura is to prevent open air defecation, ensure proper disposal of the feces, and also checking the consumption of unwashed fruits and vegetables, especially when grown on polluted fields. Thank you.